Well, it is 5:01. Of course, people can join and exit when needed, but I'll go ahead and get started. Thank you all for joining our July education call on heart health. As you know, heart health and kidney health are a two-way street, and we're very fortunate today to have Dr. Sami Sadek, an American Heart Association volunteer in the Greater Washington area, join us. He is an anesthesiologist by trade, trained at the University of Suleimani, at the College of Medicine in Iraq. He also received his MBA from American University of Iraq. He's an active member of the American Society of Anesthesiologists, and like I mentioned before, and is a volunteer with the American Heart Association of Greater Washington, D.C. So as you can see, Dr. Sadek is very busy and very involved in the medical community and volunteer community in the area. So please welcome Dr. Sadek to give you the basics on heart disease and stroke.
Okay, thank you so much, Christy. And good evening, and thanks for everyone for attending our webinar. And I will be talking about a heart disease and stroke, and then we will have enough time for questions. And let's proceed to the slides. Please just tell me if the voice is fine. Can everyone hear me, or can we proceed?
It sounds good on my end. And let me just chime in again and remind those who are on the call, if you have questions or comments, push *6 or #6 to unmute. So I think you're okay to proceed, Dr. Sadek.
Okay. So the agenda of our presentation, I'll be talking about heart disease and some statistical numbers, and then defining what we mean by heart disease and what are the warning signs. And then we will be talking about the stroke and also a statistics and some burden and causes of the stroke, both on the government and on the people, on patients. And also we will be talking about the warning signs. And then we will be talking about the risk factors for heart disease and stroke. These are combined risk factors for both. And then we will be talking about a very special program from American Heart Association, which is My Life Check, Life Simple 7. And then we will go through two campaigns from American Heart Association and American Stroke Association, which are Power to End Stroke and a Go Red for Women. And then I will talk about some website tools. You can, and everyone can go online to the website of American Heart Association and can find very useful tools on health education. And then we will have some time for questions, and we will try to answer the questions. So, heart disease in numbers. Heart disease is a #1 leading cause of death among both men and women in the United States. It's killing over 375,000 Americans each year. But the good news is that about 80% of heart disease cases are preventable just through simple lifestyle changes like increasing physical activities, exercise, good nutrition, and healthy food, or quitting smoking. So yeah, just very good news about 80% of the heart disease can be prevented. So although the number is very high, but it can be prevented. And more women die from heart disease than the next 4 cases of death, including other forms of cancer. And 90% of women have more one or more risk factors for developing heart disease. Unfortunately, it's more common in women, and especially at late age, maybe due to some hormonal changes. Another factor, of course, playing a role. While 1 in 30 American women will die of breast cancer, almost 1 in 3 will die from cardiovascular disease each year. This is just to imagine if we compare heart disease with a number of cases of breast cancer in women, and you can find that it is 10 times more common. So heart disease is 10 times more common than breast cancer in women. The estimated direct medical and indirect cause of cardiovascular disease for last year was around $6.5 billion. Yeah, this is a huge number, and you can imagine the burden of heart disease, both on the government and on people. So let's talk about the prevalence of the disease by locations. So we will be talking about in Washington, D.C. area, Virginia, and Maryland. The D.C. has a third highest death rate from cardiovascular disease in the country, and heart disease is a number 1 killer in D.C. These statistics are from the American Heart Association, and these are updated. The update is also, although the actual data is from 2030, but it was updated the last year, and they use the same data. Around 1,340 people in DC died from heart disease in 2030, and district heart disease death rate is around 547 deaths per 100,000 people. This is a epidemiological and statistical mean used to know the number of deaths in 100,000 people, healthy people. You can see the number of the DC is 547 as compared to the national number, which is 428. So this also indicates how the number are increased in Washington, D.C. as compared to other states. Regarding the Virginia, it actually has a 27th highest death rate from cardiovascular disease in the country, and heart disease is a number 2 killer in Virginia. Around 13,600 people in Virginia died from heart disease in 2030. So the number is high there also. It's number 2 killer. Regarding the Maryland has a 22nd highest death rate from cardiovascular disease in the country, and the heart disease is number 1, just like DC in the Maryland. It's the number 1 killer in Maryland. Around 11,200 people in Maryland died from heart disease in 2030. Now, the distribution of the disease by ethnicity and racial groups. As I mentioned, the statistics are from Fact Sheet 2015, update from American Heart Association, and although the actual data from 2013 and 2011, but it was updated in 2015. So the number of the heart disease among the among non-Hispanic, Black, aged 20 and older is 46% for women and 48% for women. So the numbers of the diseases is more common in women in non-Hispanic Black. The overall death rate from cardiovascular disease was 352 for male and 247 for women. This is data from 2011, but it was, as I mentioned, updated from 2015. Regarding the prevalence of the disease in white, in Caucasian, So among non-Hispanic white adults, 36% of the women and 31% of the women have a cardiovascular disease. So the rate of disease is higher in male white than as compared to the women white. So the overall death of from 2011 from cardiovascular disease was 229, which are 227 from male and 188 for women. You can see that the number is much lower in white females as compared to white male. The third group, which is Hispanic and Latinos, among Hispanic adults aged 20 and older, 48.3% of the women and 32% of men and 48.3% of men and 32% of women have cardiovascular disease. Also, the prevalence is lower in female than male in Hispanics. So what we mean by heart disease, there is a wide spectrum of the heart disease. It's ranging from diseases in conduction of the heart, in muscles of the heart, or congenital anomalies, or in pump of the heart. But what we mean here is we mean by the diseases that originated from the fat, atherosclerosis, which causing narrowing of the blood vessels of the coronary artery, that artery which supply the heart. So by atherosclerosis, we mean it is a conditions where plaque builds up in the wall of the arteries, and as a result narrows the artery, making it harder for the blood to flow through, and eventually causing lack of the blood to the heart and causing heart attack. When the blood flow to the part of the heart is blocked by a blood clot, and if the clot cuts off the blood flow completely, that part of the muscle supplied by the artery begin to die. It starts ischemia and then will be infarction. This is what we mean by the heart disease specifically in this presentation. Regarding the signs, the warning signs of the heart attack, most of the signs are from the chest. It's chest discomfort, mostly involving in the center of the chest that lasts for more than a few minutes, and that goes away and comes back. Other patients can describe the pain as uncomfortable pressure or squeezing, fullness inside the chest or pain. And sometimes the pain and discomfort is in the upper body part, such as in both arms, shoulder, jaw, stomach. And another sign and symptom is shortness of the breath without chest discomfort. So sometimes breaking out a cold sweat, nausea, and lightheadedness is another sign of heart attack. Most common heart attack symptom in women is chest pain or discomfort, but women are somewhat more likely than men to experience some other common symptoms like shortness of breath, nausea, vomiting, and pain in back or jaw. So these are general signs of the heart attack. So let's talk about a few points on stroke. By stroke is women, it's in the brain, not in the heart. Let's just talk about some statistics. Stroke is the fifth leading cause of death and serious long-term disability in the United States. As we mentioned, heart disease was the number one, while the stroke is number 5. Around 798,000 Americans each year suffer from new or recurrent stroke. So sometimes we have a new cases of stroke, and sometimes there is a recurrent stroke. Someone that gets stroke and have more chance to get another attack of a stroke. As you see from the data, around 600,000 first attack and 185,000 recurrent attacks. On average, every 40 seconds, someone in the United States has a stroke, while every 3 to 4 minutes, someone dies from the stroke. Unfortunately, the number is very high, and it's mostly related to the risk factors I will be talking about in the next slide. It causes approximately 1 in every 20 deaths in the United States. About 40% of the stroke deaths occur in male and 60% occur in female. So also the number is more high in female than in male. Regarding the ethnicity, the distribution of the disease or cases of the disease by different ethnic groups. In African American have a high risk for stroke and almost as twice than of white. In 2015, like last year, black male were about twice as likely as white male to be hospitalized for stroke. Regarding the Hispanics, Mexican American risk for the stroke falls between that of black and white. They have a higher cumulative incidence of ischemic stroke at younger age, but not at the older age. So I was talking about the stroke. We have two kinds of stroke. We have ischemic stroke and bleeding hemorrhagic stroke. Men's black and Mexican American have a higher rate of TIA, which is a transient ischemic attack, another form of the stroke, but it can be prevented if treated early. So they have a higher TIA than their female and non-Hispanic white counterparts. In Caucasians white, in 2011, overall death rate from stroke was 37.9 death rate. That was a 36.2 for male and 36.2 for female, actually the same number. In 2011, stroke causes the death of 43,464 white male and 65,000 white female. In Asians, the death rate attributed to intracerebral hemorrhage, which hemorrhagic stroke, were higher among Asian Pacific Islanders than the other whites. So you can see, you can imagine the numbers of the stroke in the area and different ethnic groups. Regarding the geography of the disease in these three states, the stroke is a number 4 killer for Washington, D.C., and number 3 for Virginia and Maryland. So D.C. ranks number 2 in stroke incidence rate out of all states in the United States. So it is ranks number 2 in the incidence rate, the new cases of the stroke. In 2013, around 187 people of D.C. died from stroke. Regarding the Virginia ranks 9th out of 50 states in the stroke incidence rate. Around 3,287 people in Virginia died of stroke in 2013. And also this is a death rate. It was 113 deaths per 100,000 people, which is higher than the nationwide average, which nationwide in all the 50 states is 98, while in Virginia it's 130 death rate per 100,000 of people. In Maryland, around 2,300 people in Maryland died of stroke in 2013. Maryland's stroke death rate is 104 as compared to the nationwide, which is 98 deaths per 100,000 people. This is just to know about the numbers in different locations. Now we will talk about some burdens and costs of the stroke. In general, around 50 to 70% of the stroke survivors regain functional independence. 20 of them are institutionalized within 3 months. And in 2015, estimated direct medical costs and indirect costs of stroke was $67.7 billion annually, which is very, very high. So, as I mentioned earlier, we have two kinds of stroke. Stroke is actually a disease that affects the arteries leading to and within the brain, that supplies the brain with oxygen and nutrients. And so if there is a block in the blood supply, it causes ischemia, but if there is a bleeding hemorrhage, it's called hemorrhagic stroke. You can see the picture, that one from the left side is ischemic stroke, and that one from the right side is hemorrhagic stroke. You can see there is a bleeding in hemorrhagic stroke, and both forms can cause death of the brain tissue, especially if the amount of the death is very large. It can cause many problems. What are the warning signs of a stroke? Strokes happen suddenly. It's not a gradual process. It just happens in a matter of seconds. You can feel, sometimes someone can feel numbness or weakness of face, arms, legs, and confusion, trouble speaking or understanding people, and sometimes trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, and coordination. Sometimes there is a severe headache with no known cause. This happens especially in cases of hemorrhagic stroke, actually. So there is a mnemonic for that. It's act fast, which means F, facial drop, A, arm numbness, weakness, and S, slurred speech. T is a time to call 911. Someone who has these symptoms should call 911 at once. So let's talk about the risk factors for the stroke and heart disease. You can see that the risk factors for both are the same. So there is not a borderline between the heart stroke and heart attack and brain stroke. So the risk factors are actually the same for both of them. So we have two groups of the risk factors. One group is non-modifiable, and another group is modifiable. The non-modifiable risk factors, you can not do anything with them. Is fixed, like age, sex, race, prior stroke, family history. These are non-modifiable. We cannot do anything with these risk factors. While the other factors, which are modifiable, and we can prevent stroke, about 80% of stroke and heart disease by emphasizing on these modifiable risk factors. Now, these include high blood pressure, cigarette smoking, excessive alcohol intake, illegal drug use, and high blood cholesterol, heart disease, diabetes, atrial fibrillation is a form of heart problem, obesity, overweight, physical inactivity, certain blood disorders, and transient ischemic attack. So the most of the work of health workers are on these modifiable risk factors, and we can prevent the heart disease by working on these modifiable risk factors. So how can we reduce the risk factor? There is a very nice program from American Heart Association. It's called Life is Simple 7. Anyone can go to the website and use this program I will be talking about later. So the Life Simple 7 is a guide that will help to prevent heart disease and stroke, and also guarantee you a longer life. It makes you feel strong, healthier, and it decreases the need for surgery, medication, and treatment, and also it provides a better quality of life as you invest in your relationship and life goal. The mission of the program is building a healthier life free of cardiovascular disease and stroke. And the goal is to improve the cardiovascular health of all Americans by 20%, while reducing the death from cardiovascular disease and stroke by 20%. So these are the 7 icons. What do I mean 7? And we will be talking about each one in the next slide. Okay. So if you go to the website, you can check your number, and you can, it's very simple steps. Everyone can use the website and the program. You can download the program from the website, and then you will choose your action plan and discover your heart score, and you can print or save your results, and you can return periodically to take the assessment again. So let's talk about every one of these 7 factors. Number 1 is managing blood pressure. Why blood pressure is important? Because high blood pressure is the single most significant risk factor for heart disease. About 69% of people who have first attack and 77% who have a first stroke and 47 who have congestive heart disease, heart failure, have a blood pressure higher than 140 over 90 millimeter mercury. So if your blood pressure higher than the normal, you have a 70% chance of getting heart disease and stroke. So if someone have what we can do to manage this problem, there is a list of actions can be taken. First of all, you should check your blood pressure, know your number, and track your progress, and learn health habits for eating well and staying active. The number 2 is exercise. Get active. You know, people who exercise have a better health than those who do not exercise. 35% of adults who do not engage in leisure time physical activity, according to 2012 data from National Health Interview Survey. So, it's just a good news. It means that 65% of people doing regular exercise, while only 35% of adults do not engage in leisure time physical activity. No leisure time physical activity is a phrase sometimes used. It means that it refers to a non-session of light, moderate, or vigorous physical activity for at least 10 minutes duration. So, you know, the action can be taken is make your decision to get moving, choose activity you can enjoy, and start working. So walking is exercise. Now, the third factor is cholesterol. When there is too much cholesterol in your blood, you are at a major risk for heart disease and stroke. Around 98.8 million American adults have a total blood cholesterol level of 200 milligrams per deciliter or higher. So, the total cholesterol should be around 170. If it is 200, it's high. It's regarded as a high total blood cholesterol. So it causes more chance for atherosclerosis and eventually heart attack. Women over the age of 60 are more likely to have a high cholesterol and blood lipids than men. Of course, this is due to a menopausal and hormonal change. So the action should be taken is follow your healthcare provider advice and make healthful choices and get active. The number 4 factor is eating better. So a variety of heart-healthy nutrition keeps you living at your best health potential. You can visit this governmental website, choose myplate.gov for healthy eating information. There is a lot of information, and you can use that information to choosing a healthier foods. The action to be taken: say yes to lots of fruits and vegetables, whole grain, carbohydrates, and fat-free and low-fat dairy products, fish with omega-3 fatty acids. And you should say no to foods with beverage and added sugar and products with high in sodium salt. Number 5 factor is weight. We have an indicator for weight which is called body mass index. It's the body mass index. The number is measured by weighing your weight and over your height by meter square. If less than 25 is optimal, while 25 to 29 is regarded as overweight, and above 30 is regarded obese. Some data showing that among people ages 55 to 64, 80% of men and 70% of women are overweight, and their body mass index is between 25 to 27 or 30 in case when they are obese. And when people aged 65 to 75, 70% men and 69% of women are overweight or obese. So action should be taken is choose to invest your energy on the task, not feeling guilty, keep your body mass index within the normal range, and know how many calories you need per day and use that calories, spend that calories in exercise. The weight loss plan: reduce calories in, plan your food choice, and stick with your plan. Increase calorie out, engage in a regular physical activity, around 30 to 45 minutes per day. Number 6 factor is smoking. Smoking is the number 1 modifiable cause of death in general, and cigarette smoking causes more than 480,000 deaths each year in the United States. And this is nearly 1 in 5 deaths. So action should be taken is talk with your healthcare provider and focus on the rewards, plan your response to roadblocks. The 7th factor, the last one, is reduce your blood sugar. High blood sugar encourages the growth of plaques in your arteries and increases your risk for diabetes, heart disease, stroke. An estimated 7.1 million Americans have undiagnosed diabetes, which is called prediabetes. Usually, American Diabetes Association using American Diabetes Association criteria of fasting blood glucose of 126 milligram per deciliter or more. So if you're fasting, although they are using lower number, but American Diabetes Association still uses that number 126. The action should be taken is make a good food choice, commit to a regular physical activity, and maintain a healthy weight. This is a life sample 7 factors. There's also 2 campaigns. I'll quickly go over them from American Heart Association. These campaigns are Power to End Stroke and Go Red for Women. The Power to End Stroke is a campaign to raise awareness in African American community about their number 1 leading cause of death, which is stroke. The Power to End Stroke is an aggressive education and awareness campaign that embraces and celebrates the culture, energy, creativity, lifestyle of African Americans. The mission of the program is to create a movement and drive the message that stroke is largely preventable, increase awareness of the high blood pressure, diabetes, stroke, promote adherence to primary and secondary prevention guidelines in communities, especially in African American ages between 28 to 64. Unite African Americans to make an impact on high incidence of stroke within their community. There is also some awareness events like Power Sunday, Power Award Weekend, Power Weekend, Stroke Screening in partnership with DC Hospitals. These are the campaigns and programs from American Heart Association also to increase health awareness among the African Americans. Another campaign program is specially designed for women. It's called Go Red for Women, a campaign to raise awareness in women about the number 1 leading cause of death, which is heart disease. Go Red for Women, powered by American Heart Association's research, educates, connects millions of women of all ages. Only 1 in 5 view heart disease as their greatest health threat. That's why American Heart Association Go Red for Women helps fund cutting-edge research, conducts life-saving public and professional education programs, advocates for protection of women's heart health. Thanks to the participation of the millions of people across the country, the color red and the red dress have become linked with the ability of all women have to improve their heart health and live stronger, longer lives. Also, there is a American Heart Month, which is February. February is American Heart Month, a time in which American Heart Association emphasis it is Go Red for Women campaign. It is, it's a national Red Day, which is Friday, February 3rd, 2012. Go Red in your one fashion to show the world you compassionately support Go Red for Women, the American Heart Association's solution to save women's life. So these are 2 programs for American Heart Association. There is some useful tools on the website. Everyone can go to the website, American Heart Association, and you can find these tools on the website. Check My Life, and this is a health assessment that generates a health score and personal actions that's designed to help us live a long and productive, healthy life. Another program is Health 360.org, organized center for your health information. You can track your cardiovascular wellness, create goals, track progress, and share information with your healthcare provider. Red Bataru is a 12-week science-based online program allowing women to set and reach realistic goals to improve their overall health. And also, Go Red for Women and Power to End the Stroke, as we mentioned. These are useful tools, and everyone can go to the website and use these tools to know about more heart disease and stroke, and to know about their number and their plan to educate yourself and have a preventive plan. So this the presentation. I will be stopping here, waiting for you if anyone have any questions regarding the presentation, and I will be happy to answer the question.
Well, first off, thank you so much for all that great information. I want to remind folks for questions to push *6 or #6. And I'm not sure if you can see the chat, Dr. Sadek, but one of our participants, Alan, asked that if chest pain clears up after taking nitrostat tabs, should you still call 911?
Yeah, of course, because if the patient already has a chest pain, and if he on medication, you know that the pain from the heart, and he already have a prescription drug, you know, you should follow the doctor's advice. But I do not recommend if you have a chest pain, you take the pill and don't call 911. So it's best when you have a chest pain discomfort, call 911. Yes, of course. If if the patient is already diagnosed with angina, there is a form of the heart disease. If the patient knows that he is having angina and having a heart disease, he's on medication. If he takes the medication and the pain will relieve, it is fine as far as the doctor told him or her. But for new cases, not recurrent. For new cases, yeah, it's absolutely better to call 911.
Hi, sir, this is Mikini Wilson. I'd like for you to mention the websites. I joined the call late, and I apologize for that. I have the American Heart Association and the Heart Health 300 or 360, I'm sorry. And are there any other websites?
You mean the other website?
Yes, you said the American Heart Association is one website.
Yeah, and there is American Stroke, and also there is a Center for Disease Prevention and Control. Yeah, there is lots of websites that have much information of health, and different hospitals, they have information for the patients. You can also get enough information about your health from your healthcare provider. So it is better, sometimes to use authenticated websites. Sometimes, there is a lots of information on websites, and sometimes they can misleading you. So it's better to use authenticated websites. And also, in any case you have a question about your health, it's better to call your healthcare provider and to get advice from him.
All right, thank you.
You're very welcome. Thank you for your question.
You're welcome.
Are there any other questions before we conclude this evening? Again, *6 or #6 will unmute your line. Or if you are online, feel free, you can type your question into the chat box as well. Well, Dr. Sadek, like you are familiar that most of the patients that we have, or most of the participants that we have on today, have kidney disease and either are on dialysis or have had a transplant. Can you think of any specific recommendations for them as far as what they should look out for as far as heart health or any lifestyle changes they should make to make sure they're continually heart healthy?
Yeah. First of all, it's, as I mentioned, it's better to keep in touch with their healthcare provider in any case if they have a question or they have a concern about their health. Yes, there is a connection between heart disease and kidney disease. You know, the heart disease is pumping out the blood, and the pressure generated, it depends on the kidney regulation. You know, the kidneys are regulating the nutrients and the electrolytes, which are useful for pumping heart. So whenever there is a problem in their kidney that negatively affects the heart. So it's better to keep their eye on their kidneys and regular checkup. They should know about blood urea nitrogen level and creatinine level, and always keeping in touch with their healthcare provider, and they're having a regular checkups and tests because the kidney is very, very related to the heart because it's, controlling the blood pressure through the electrolyte. So whenever the symptoms of the kidney disease are worsening, it can negatively affect the heart. So in general, they can use all these specific education guidelines like eating healthy. But regarding the exercise, they should be aware about their exercise because the exercise we are talking about, for example, 40 minutes or 30 minutes, it's based on the healthy people. If they have a problem in breathing or walking, they should be very careful. They should first follow the guidelines about their situation and then emphasize on other aspects. So yes, so it is very important to know about the situation first, and then emphasis on the heart disease, as I mentioned, is very close connection between heart disease and kidney disease.
Great, thank you. Are there any last minute questions before we conclude this evening? Again, I want to thank you all for joining first, and especially at this new time. I know we've never done anything in the evening before, so I really appreciate it. But any last minute questions? Assuming none, of course, thank you so much, Dr. Siddiq, for taking time out of your busy schedule to provide such great information about heart health and stroke awareness. And I can't express how appreciative I am for you and your information, and I know those on the line appreciate it as well. If there are no other questions, then I do believe that will conclude our education call for July. If you do think of any other questions, maybe you're not comfortable asking, feel free. You can always send them over to me, and I can get in touch with Dr. Siddiq to ask those questions. And again, thank you so much, and I really appreciate it.
Sure. Thank you so much. It's been my pleasure and thanks for having me to participate in this webinar. And I hope healthy life for everyone participated in our program.
Thank you.
Thanks, Christy.
Thank you.
Thanks.